All right. So, did you want to talk?
Sure. So we're going to talk to you about the carpal tunnel program, which is also in your packet.
We're just making this up as we go along.
Yeah.
So,
So I actually see them for carpal tunnel release syndrome, or they have a release done, and then they come in like once post-op. And so a lot of times I'm guiding them in their home exercise program. And so basically the handout goes through a lot of blocking exercises. And so what you want to do is, I can use you as a patient basically.
Mm-hmm.
And what you want to do is we want to block the MP joints and then bend at the PIP to get.
Do you like to do it up or down?
I like to do it up,
Okay.
because I just feel like it's more comfortable, but everybody's different. So then basically you would hold at their D1, and then you are supporting here, so then they can actively bend their PIP.
It's hard for me not to bend the third one.
Yeah. So then, and then you would go down each of the fingers. So I'll hold and then go ahead and bend.
So you're trying to just have one tendon move.
Right. So when you're blocking, when the PIP is moving, you're working on the
Flexor.
digitorum superficialis.
Mm-hmm.
Because it ends at the D2, like phalanx part of the finger. Now, when you're gonna block at the PIP joint and you just want the fingertips to move, that's a different tendon, and that's your FDP, so your flexor digitorum profundus. I didn't think about that.
Yeah.
So make sure you're stabilizing at the joint, so that way just the tip of the finger is moving, and then you just want to slide down and complete each of the fingers.
So this is kind of hard to do on yourself, to do blocking, but if you are going to try to do it on yourself, what I tell patients is to kind of block with their other hand and kind of, block all the problem is sometimes you're blocking all the fingers.
Yeah.
You can some patients just can't figure out how to do it on their own, but ideally you want them to be able to do it at home, but it involves blocking their fingers, and it's kind of, that might be a little bit easier, right?
Yeah, so I'll actually have them demonstrate it on themselves after I teach them, just to make sure that they understand where to hold, and that tends to be a lot of the time because they don't know where to hold. But I think creating that isolation is hard, and I think it just takes practice to get each finger to bend where you want it to bend.
Mm-hmm. Yeah, so the blocking exercises are not that hard. It's just, it is hard for the patient to understand what they need to do for that.
Mm-hmm.
And that's really, but that's what you teach them post-op. In terms of the handout in the packet, there are other exercises that you can try in here. I did want to just say, for the contrast baths, I think that's kind of an old school OT thing to have people do contrast baths, and that would be not really post-surgical when they have their incisions still healing, but that would be just conservative. The idea with contrast baths is really just having hot, cold, and having that pump to bring out the fluid.
Mm-hmm.
I don't know how well it works, and there's not really good evidence behind it. But if you hear old school OTs talking about contrast baths, that's kind of what it is, alternating between cold and hot. I don't have amazing experience with this, but I just want, I guess, you to be aware.
Yeah, I only have really one example. We did it, and he had pretty severe edema in his hand, and we did contrast baths once a week for 3 weeks, and it really did help his edema. but he didn't have any carpal tunnel symptoms, so
Yeah.
it was mostly for edema management.
Yeah.
So it just kind of depends on what your goal is for using that treatment.
Mm-hmm.
So
So anyway, that's, I mean, the biggest thing with carpal tunnel syndrome and conservative wise is wearing a splint to stop that movement. And again, it would be that, ooh, I'm gonna step out of the picture for a second. It would be that wrist cock-up splint, but there is some thought that it needs to kind of go higher on your fingers. Have you heard that, Margaret?
I have not, no.
So it can either, leave all the fingers free, or I've known some therapists who will extend it a little bit to stop even the fingers from moving, to try to stop those tendons from moving very much. So, I mean, traditionally you would do like a wrist cock-up splint, kind of like this, for carpal tunnel syndrome, and that's pretty much what we do now. We don't see people a lot for carpal tunnel syndrome, even post-surgically. It's not, it used to be that we saw them for visits and visits, and we don't really do that anymore because the evidence doesn't support that so much.
Yeah, I would agree. I see them for one session after their surgery, and then they're on their way.
Yeah.
So.
And you pretty much just have to teach them they need to immobilize the wrist for a time, and then the symptoms tend to go away. So that's it on carpal tunnel syndrome.
Yep.